It is something that can affect facial mobility and can happen overnight, out of nowhere, and can be very challenging in terms of handling it. I'm talking about Bell's palsy. I'm not going to define what it is. She's a professional. She'll give you more on that. However, along the way, we're going to learn how acupuncture can support Bell's palsy. Again, I say this every time I get together with her. All those things that acupuncture can support, I never knew. I'm sure you would say the same. We learn more every time we get together with our professional of the year, Dr. Kelly out of New York City, acupuncturist, Chinese medicine expert, herbalist, joins us once again. How are you doing today, Dr. Kelly?
I'm doing good, Steve. How are you doing?
Very well, very well. Before we go anywhere here, Bell's palsy, how do you define that?
So, Bell's palsy, what it looks like, the symptom is half of the face kind of like drooping. They couldn't close their eye, they couldn't close their mouth. So half of the face looks different with the other side. That's the symptom. And in Western medicine, usually they think it's virus infection. So in the facial nerve, so usually Western doctor will give them antiviral medicine, will give them cortisol steroid, medicine to reduce the inflammation. That's the Western medicine way to treat it. I have some people, have some patient who got Bell's palsy. Um, they said they went to hospital, they got the medicine, but their face still looks different. They may also have like a jaw pain, like their face looks different, feel different.
I know somebody from way back whose wife got Bell's palsy and it happened. And I don't know if there was a pre-existing situation. I don't believe so, but she fell asleep with her face against the car window in the winter. So it was cold. And from that point, Bell's palsy developed. Um, I didn't know it was connected to a virus. And I mean, that might have been an isolated situation. I just don't even know how that could have taken place. But still, to your point, the paralysis, the restriction of movement, all of that definitely challenging. What is if it's on acupuncture, what is the normal course of treatment when you have Bell's palsy?
Okay, Steve, you give a perfect example. Actually, you said the friend falling asleep next to the car window because it's cold, it's winter. Actually, one of the pattern is wind cold inveiling to the facial nerve.
Wow.
Basically, right? Winter, cold, wind, window. That's happened to the other patient who is, I think, 22-year-old boy. So is on that day he got a vaccine. Then somehow he felt so hot, he opened the window. He slept with the window open whole night. Next morning, he got the Bell's palsy.
Wow. it's, it's pretty concerning. Um, so once that nerve is affected, or the nerves in your face from the cold, how do you undo that? If it's not acupuncture, what would what would take care of that? And is that also a virus situation, or that's just the something that's affecting the nerve?
Well, in Western medicine, they think it's a virus. That's why people will be given antivirus medicine. They also give cortisol steroid medicine to reduce the inflammation in the nerve. But to some patients, that medicine is not enough. They still have the symptom. Their heart face still dropping. Um, so in Chinese medicine, we treat in a different way. In Chinese medicine, we don't talk about the virus. We don't talk about bacteria. We talk about the wind. We talk about the cold. So if the cause is wind cold, we simply, you know, pacify the wind. we make the wind going away.